Okay, this is your orientation to our Istan, which is the basic med-surg model that we have. We have two of these simulators. They're very similar. The main difference is that one of them is ventilator tolerant, so they can be on the ventilator with real settings, versus the other has to be in more of a simulation ventilator mode. So I'm just going to go over kind of some assessment techniques that are generalized to most simulator mannequins and what they can do. So you see on Istan, he has pretty realistic feeling skin. Tape doesn't stick real well to him, so we have our IVs that are pre-started in each brachial artery, each brachial area into the antecubital vein, and we have our pulses that you can feel throughout the body. So on Istan, he has a carotid, which is somewhat a little bit deep, and you have to press a little bit harder. The one thing about his pulses is that they are action generated, meaning that when you press in the right spot with the right amount of pressure, the pulse will begin. If you let off or you press too hard, the pulse will stop. So if you are taking a pulse and you happen to move your hand a little bit and it stops and then it restarts, that's just how the simulator works. It records everything that you touch and palpate for your pulses on the workstation in the control room. So it allows your faculty to know if you really did feel that pulse. All of the pulses are bilateral, so we will have our brachial pulse, which is just above the bend of the arm. So you have the arm that bends here, and it's on the medial side of the arm, and you're just going to press there. And then you have your radial, which is along the thumb. Sometimes it's easier, since they are action initiated, you're going to just kind of lay your hand until you feel that pulse begin. Then you have your femoral area, which is just down in the groin area. Kind of have to feel around because there are some different skin layers down there, and you're going to have to feel until you feel that pulse initiate. There we go, got him there. Then he has a popliteal, which is just below the bend in the knee. So if you feel behind the knee in the center, then that pulse will begin once you have your hands in the right place. Your posterior tibial is just below the ankle bone on the internal side of the foot. And then you have your dorsalis pedis, which the easiest way to find it on these mannequins is to make a letter C with your hand, cup the small toe, and lay your fingers there, and you will be able to find it. On Istan, you have the ability to listen to heart sounds, lung sounds, and bowel sounds. All of your sounds are heard through speakers, so that's very different than on a human. If you're not over the correct speaker, then you're not going to hear the sound. So I'm going to show you the best places to listen, and these are pretty much universal with Lucina, Istan, HPS, and the OR. They're all going to be in about the same area. The key is if you're not hearing a sound, you're hearing the movement of the mannequin. So you'll want to move your stethoscope around and try and make sure that you're over that speaker. So for your lung sounds, you have 4 speakers on the anterior side. You have 2 right above the nipple line on either side of the sternum. And then you have 2 in the mid-axillary line on either side. So 1 here and 1 here. So that is to represent the upper lung fields and then the lower lung fields. For your heart sounds, you have 1 over in the aortic area, and then you have 3 additional speakers over along the other heart sound areas that you have. They are controlled by volume, so just if you can hear one better in one area, it doesn't necessarily mean anything physiologic with your patient. It's just how the speaker sounds through your stethoscope. Then your bowel sounds are, there are 4. They represent 1 in each quadrant, and they are direct out from the umbilical about 2 inches. So your uppers are here, and your lowers are in this area. So you'll want to make sure that you have your stethoscope over one of those speakers. The lung sounds will sound, you'll hear the breathing in and out. The heart sounds will sound more like a clicking, so it'll be a ch, 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 ch. Or if it's a very quick rhythm, it may be a ch, 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 ch. That's love dub, love dub. Or if you have, say, an S3, it would be a ch, 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 ch. So an extra heart sound that you would hear. Your vowel sounds are very similar to what rustling of paper would sound like, and they can be absent, hypo, normal, or hyperactive. And it's a gurgling kind of rustling sound. So you can catheterize Istan and get urine output. If you do that, we always ask that you use a spray lubricant, which we keep in the room. So if you notice over on the chalkboard, you have a spray lubricant. You just need to do everything the same for the Foley catheter and have one of your peers just spray the tip of the catheter with that lubricant prior to inserting. And then we inflate the bulb with only 5 milliliters. So we do not inflate the bulb with 10 milliliters. If you insert a Foley catheter and you believe that you're where you should be and you don't have any urine return, then your faculty will tell you to proceed or to wait until you get urine return. On Istan's thumbs and large toes, you can press and get capillary refill, which may not be turned on, but it will be a bright blue, and it will be either go away in your less than 3 seconds or greater than 3 seconds. So you'll want to check that on either one of his upper as well as his lower extremities. Istan can bleed. He can bleed from several different areas. He can hemorrhage, he can bleed a little bit. He can sweat, he can cry, he can have saliva. You can put an NG tube down, but it doesn't go very far, so we'll usually have that placed for you already. He can be intubated and on the ventilator as well as defibrillated. So if you've watched the medication room orientation with the crash cart, I mentioned a hands-free defibrillator kit, and these little accessories that we've put on him are where those clips slide onto. So you'll snap those onto here, and it will act as though you have your 2 pads on, and you can proceed with either your pacing or your defibrillating. Istan can also have a trach done. He can have a chest tube in. He can have, issues with his lower extremities. He can actually lose one of his lower extremities for an amputation. So lots of different things that can happen. We put makeup on them so to make it a little bit more real for any types of injuries or surgeries and that type of thing. Istan's, one thing I did not mention is that Istan's pupils do react. Sometimes the light in these rooms are really bright, and so the change is very subtle, but you can check pearl